Good afternoon. Welcome and thanks for joining us for today's HIS Talk webinar, Location, 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 How to Deploy RTLS Asset Management for Capital Savings. It's brought to you by Versus Technology. I'm Lori from HIS Talk and I'll be moderating. I have a couple of housekeeping items to make you aware of before we start the webinar. Attendee phone lines have been muted to prevent background noise. Please use GoToWebinar's questions box in the console to submit questions to our presenter at any time. The presenter will answer your questions during Q&A at the end. Today's webinar is being recorded, so you'll receive a link to the recording as well as a PDF version of the PowerPoint presentation. Our speaker today is Doug Duvall. Doug is a solution architect at Versus Technology. Prior to joining Versus, he spent 8 years as a system analyst supporting the Versus RTLS and other systems in a hospital setting. Before that, he spent 5 years as a certified anesthesia technician, which gives him a real understanding of the urgency and nuances of a clinical environment. With that, I'll turn it over to you, Doug.
Great, thank you, Lori. Thank you to his talk as well for allowing us the opportunity to talk about this topic today, a topic that I'm quite passionate about. So let's get this started. One of the things that I'm seeing more and more now in this role as a solution architect, and one that I can appreciate as a former customer, is that the types of questions that we get, the types of concerns and challenges that organizations have that bring them to this precipice of what is asset management and how can it help me? And one of the biggest concerns is finding equipment when you need it. There are so many different pieces of equipment within a hospital or healthcare setting. And so much of our time, nurses, technicians, nursing assistants, medical assistants, spend away from the bedside looking for equipment. Regardless of the size of the facility, there's always an issue where when you're looking for something specific, where is that bladder scanner? And you send out the masses trying to find it in the moment. Not that that's an urgent need, but when you want to use it, you want to have it available. You want to be able to care for your patients in the most efficient and best way. You want their experience to be the most positive. Having equipment ready is one of those important pieces of that, so that you can take the best care of your patient. The other piece of that is that we've seen in studies and in surveys as well that staff spend over an hour of their day looking for equipment. That's a pretty significant portion. So what does asset management via RTLS do for me in helping me find equipment when it's needed? The other part of that, from the caregiver bedside perspective to the clinical engineering and biomed technician side, we have these other roles that are key to maintaining and repairing equipment. So not only do we want the equipment ready when we need it, but we also want it functioning. And JACO expects 100% compliance on preventative maintenance in a healthcare setting. So how do we help our clinical engineers and biomed folks find that equipment efficiently? I've seen many a time when a biomed person heads up to a floor in a hospital and they have a ticket that's printed out from their management system, says such and such needs to be repaired. They go to the charge nurse who has no idea where that equipment is, and they spend time walking around the floor trying to find that piece of equipment. So can asset management and RTLS help me in this case? Also, trying to best understand equipment utilization. We have 1 million square feet in our hospital. We have thousands of pieces of equipment. Do we truly understand how we're utilizing those pieces of equipment? Do we understand how many we have? How much time are we spending doing inventory manually? All those sorts of things. Do we have storage closets or buildings that have so much equipment in it, we're not even sure what's in there? And even if we do know what's in that room, can we even efficiently find it? And also, one of the big questions, especially for folks in the C-suite, is there a tangible return on investment? So it's nice, and for many reasons, to be able to help folks find things more efficiently, to help nurses and other caregivers and biomed technicians better utilize their time. There's real value in that. But a lot of times it's the dollars and cents is what it comes down to. What is the return on investment? Is it tangible? When we're talking about that utilization, if we better understand how we use our equipment, how much we have, can we make better purchasing decisions? Can we even make better decisions on when, during high census, we need to rent or lease equipment? Can we just better understand our needs such that when we make those decisions, we can make the best decision and potentially save thousands, if not hundreds of thousands of dollars during different projects and purchases? So with asset management, those are some of the questions that bring us to the table. But when it comes to RTLS, I want to differentiate a little bit between RFID, or radio frequency identification, and RTLS, real-time locating systems. Oftentimes I find, and even did so in my previous roles, that RTLS gets tossed into the RFID bucket. And they're not exactly the same thing, even though there are some similarities. The radio frequency ID, I like to think about specifically that ID part. The tags used in RFID, often what they're doing is containing information about that item. And there are two types of RFID. Passive RFID is a tag that contains information, but it has no power. There's no power source, and it's often something that's read by another device, and it actually pulls the power from that device and transmits the information. The active RFID is battery or powered in some way such that it can transmit a signal and share that ID information to the system. We see these in different settings, some shipping, sort of different logistical scenarios. In healthcare, this is often used in sterile processing to understand instrumentation, cleaning, and the different parts of the process that it's in along the way, preparing it for surgery again. RTLS, on the other hand, may actually leverage RFID, specifically the active RFID, but it's about the real-time display of this information. It's about passively conveying that real-time location. It has hardware and software typically, but it often then leverages these technologies to give you that real-time locating. A chart that my teammates put together that I think helps to understand this, you'll see that on the left, real-time locating systems. There are a variety of different technologies used with RTLS, from radio frequency, infrared, the two together, ultrasound, some sort of Wi-Fi and leveraging of Wi-Fi. But you'll see Wi-Fi I actually have under RF because it uses a radio frequency signal. And RFID, specifically the active, can flow in and provide information to an RTLS system. So it's a minor distinction, but I think it's one that's helpful to understand, that they can work together, but they are really, they have two different purposes and two different practical applications. So an organization has answered some of those questions. They understand the technological landscape a little bit better, and they're deciding to move forward with asset management. And one of the things that I think, based on my previous project experience as a customer, that's so important is including the right stakeholders up front. Now, this isn't rocket science, and many of you know the value of this, but I want to stress the importance of pulling the right people in at the right time. And I start here with clinical engineering and biomed technicians because I think their role is often so crucial, and they often drive the asset management desire and are the ones looking to have that help, have a system that can work with them and give them that location information. They're also the role that, you know, as I said before, does all that maintenance and repair work, but they're also onboarding new equipment, which provides an opportunity to add stuff to your RTLS system. But I think their role is crucial as a significant stakeholder in the process of managing equipment, and they should be included early on in the process. I also think, because RTLS often has software or requires software to function and give you that real-time visibility, that you need to include your information technology and information management folks. You're going to need folks that know about infrastructure, about server and SQL databases, you're going to need folks that can understand the software, who can not only help implement it, but they can also support it as it goes live and gets put into use, and support the end users who are going to leverage it to give them this location information. And supply chain. Supply chain often are the folks that are responsible for making sure that equipment is available and ready for caregivers. Supply chain may be ordering equipment or supplies. It depends on your organization. They may be essential in your management of equipment, depending on the replenishment design, depending on your approach to asset management, but often are a key player in making sure that equipment gets where it needs to go. Process improvement professionals, your lean black belt folks that can help with that just-in-time approach, who can actually pull all these stakeholders together, can help come up with a design that works, and are such an important role, as often they are engineers in the design of asset management projects. I think they often know when to bring in these different stakeholders, when to make sure that the design is, that it's whoever it's affecting is actually included. And this list is not meant to be exhaustive, but those are the folks that often can drive the project moving forward, or may even lead the project. And I don't want to leave out our bedside caregivers. Oftentimes I've been in projects where, unfortunately, nurses are sometimes the last ones consulted. That's not always the case, but they're the ones often that are the most impacted by these types of systems and projects. And asset management is no different when it comes to equipment they use on an everyday basis. For example, an IV pump. If you're looking at managing IV pumps throughout a facility, they're ones that are going to be starting those medications, starting those IVs. You want to include them at certain points in the project, because I think really what you can have is a cultural impact in your organization. I think you can move and change the culture in such a way that instead of having folks that actually hoard equipment, you can actually build a level of trust such that they will know and believe that there's equipment ready when they need it. I'll talk a little bit more about that in a few slides, but I think that's a piece that maybe is not undervalued, but should be valued more, is that we can literally, and I've seen it, change the culture, where instead of having that little closet where the nurses stick everything that nobody knows about, or other units don't know where to find it, that they can actually trust that there might be a clean supply or some other storage location where that equipment will always be ready for them. So just again to stress that these stakeholders are so important to the planning and design of an asset management project. And also during this process, the goal too is, collaboration. Collaboration requires a shared vision for all stakeholders. It helps to break down those silos we work in on a regular basis. So just stressing the importance of having this cross-functional team as you move forward. I also want to distinguish between locating and management. I think locating of equipment has value inherent in itself. This picture illustrates an IV pump on a pole in a hallway. Looks like maybe even an ICU. Knowing where that IV pump when you need it is an important thing in itself. You can see there's a little tag on the side of it. Perhaps that's communicating to an Rtls system that then provides visibility on where that IV pump is. It might be something like a list view here, where you can look and see, hall by patient room such and such. That's where it is. The staff can look on a list. They can walk right to the piece of equipment. Perhaps it's a floor plan view or a different type of view that gives you either a specific or general location. But just the ability to use technology to look and see where something is saves time. The difference here is, and one example I want to give on the value of the location is a project that I worked on in which we were actually doing RTLS for patient throughput in a labor and delivery department. But as part of the project, we also affixed some tags to some of our essential equipment. And one of those items was a hemorrhaging cart, or a hemorrhage cart. That is an urgent piece of equipment needed in the moment, often postpartum, to care for women in labor and delivery. We had an example where we actually, at go live, day one, within the first few hours, we're using the system, patients are being wearing badges and being located in the system. We're seeing the different functionality come into play, and all of a sudden we have a hemorrhage. They were able to use the technology on that list view I showed you a second ago to identify which patient was having the hemorrhage. And then immediately the OB tech came out of the room, started looking for this hemorrhage cart. One was in use. Where is this other cart? Somebody along the way, another tech or nurse said, hey, have you looked on our new Rtls system? They walked up to the new view, they found the hemorrhage cart, saw the location, walked right to that place, grabbed the cart, brought it back to the room. Within minutes, the tech came out, the nurses started chatting. Not only did that location information pay dividends immediately, but it also provided some buy-in from staff. Staff saw the value of understanding how important finding something efficiently really is, how that technology could provide that valuable information of location. Now, management, or managing assets, I think takes all that really good stuff, for lack of better terminology, and leverages it and adds another layer or two or three on top of that. And one of the ways that we can do that is through periodic automatic replenishment. Can we take an item like an IV pump? Can we establish some locations where we're going to guarantee that there's always a par level, a minimum amount, such that through technology with passive and active functionality, we can more efficiently distribute and manage this equipment throughout the facility, and again, help to change the culture and build the trust with staff. And I'm showing you an example of a par level view where you see colors that indicate when things are critical or have too many, because both things are important. If an area needs more equipment, then you want to bring that equipment to that location, but if it has too many, it may be an opportunity to take some extras and move them to another area that's in need. And some of these things become more challenging the higher the census of the facility. And then a system like this can be even more important, because then you can see, oh, well, I can take one from here at this location, and one from this location, and move it to this other location that's in critical need of some additional equipment. So we're taking that location information, we're building some things into the technology that allows some views and some real-time management of the equipment, such that we can better leverage the equipment we have and get it to the bedside in the most efficient process. So the clear thing here is taking that important location information and leveraging it in an example like an IV pump par level solution. I also want to talk about the importance of understanding the accuracy of location. Rtls systems have different levels of granularity. There are different technologies they leverage in order to get that granularity. You see in an image here that we have on the first floor where there isn't an access point, a wireless access point, but you'll also see there's an IR sensor in each of the patient rooms. So on the first floor, we can get some general information from the access point, but that infrared sensor within the room gives us very granular, specific location. On the second floor, you'll see that the IR sensor is not there, or whatever other type of repeater or device is installed in the room to give you the granularity, but we do have the access point. And that access point can give us some general information about where that item is. To give you a different visual that relates, you'll see that IV pump 404 is specifically, as in the other image, in room 103. However, the wheelchair itself is in the east building, second floor, and that's based on that wireless access point. So some of the things to think about as you're moving forward is different types of equipment have different needs when it comes to location granularity, and different solutions from different vendors have a variety of ways to accomplish both general and specific location. So thinking through that, thinking through the leveraging of a Wi-Fi system, thinking through adding other pieces of hardware to get granularity, just being aware of those things generally. And I will come back to that and talk about a little bit more about the Wi-Fi versus other hardware, but just starting that conversation now. As we move into weighing the total cost of ownership, oftentimes I hear as a solution architect about the financial challenges. All organizations are looking to save money on purchases. They're looking at different technologies, and sometimes the decision is based solely on the budget for the project. But also it's important to understand the solution you've chosen and what the different costs are. Is there a one-time cost up front that is, prohibitive to purchasing the system? Or are there perhaps recurring costs over the lifetime of the system, whether that's purchasing batteries, annual costs related to required IP addresses, maintenance, annual maintenance fees, or is that initial hardware, and perhaps that initial hardware install on one system might seem prohibitive, but the long-term costs are pretty minimal, as opposed to something that's a little easier to swallow up front, but in the long run may require more maintenance or costs. So thinking about that investment from with a long-term view, I think is important when considering the different options. Which again leads us back to where we just were with Wi-Fi versus wireless. I think there are options that provide you with good general locating information where you can leverage current infrastructure, where you can leverage Wi-Fi access points. However, there are some challenges to Wi-Fi locating. Do you have enough density of access points? The location is based on that density, and in some environments you need additional software to get that location piece from your whether it's a Cisco or something like that. It's very zonal in the way that it provides location information. Or if you are leveraging that, what other hardware might be required in order to get better, more accurate and granular location, as opposed to installing a new system, something that has maybe proprietary hardware or requires cabling, or just adding additional other wireless functionality and hardware that leverage that system, but truly understanding what you're getting as far as the granularity based on your needs and management of the equipment. And when you think about it, is Wi-Fi really wireless? Because you think about all those access points you have. And in order for those access points to function, you have cables that run through the ceiling back to the data closet and connect to the network. And when you think about wireless, often Rtls systems are truly wireless, but they might actually be connected to the network in the same way that your Wi-Fi access points are. So trying to think about, all this technology we have appears to be Wi-Fi or wireless, but there's an infrastructure involved. So just helping to understand how those things work and how they're really quite analogous to each other. And again, the level of accuracy, again, these different technologies, the different solution, what are they going to provide for me when it comes to the level of accuracy? It may be a support building. You may not need to know specifically where it's located. Maybe the second floor east end is accurate enough because that's a maintenance area. I don't need to know the room. But in a hospital care setting, I may actually need to know that that equipment is in a patient room. And sometimes there's a way to have a hybrid approach to managing your equipment based on those needs. Now, I mentioned the importance of including the right stakeholders. That's kind of project management 101. When it comes to asset management 101, I want to stress the importance of having a good replenishment design. I also want to stress this is where I think having a process improvement engineer or a lean consultant can be crucial to making sure that this is done well. Specifically, I spoke of the periodic automatic replenishment model when managing IV pumps. Par leveling is used in all sorts of soft and hard goods within a hospital and clinic setting. You have supply chain or other folks that go around and scan barcodes and ensure that you have the equipment or the bandages or the fluids you need at all times. But when it comes to the design for this type of RTLS implementation, I think it's important that you have a good solid focus on where it is, what your objective is, what the challenges are, and that those folks that are a part of that cross-functional team can have input along the way. The PAR approach, I think, really is, again, getting back, I'm kind of weaving some threads here of some themes throughout to that, wanting to ensure that you have equipment ready when it's needed and building that trust with caregivers such that you change the culture. And how you approach that PAR will be important to engage those caregivers. If the nurses on floor 5 say, we always need IV pumps in the clean supply room, great, but maybe the nurses in ICU, their unit is divided differently and what they're telling you is something different. So involving those stakeholders, coming up with a good solid approach, and also then who's going to be responsible for replenishing these items. Perhaps it's supply chain. Some organizations call it distribution. The folks that you normally call and say, hey, I need an IV pump. Who are those folks? Because they're going to have some actually good insights based on their experience on a daily basis and be able to help you come up with how that PAR approach should really work. Some of those questions, that I just touched on are where it should be stored, how many will be in that location, establishing that level, whether it's critical, regular, or high, how the supply chain folks, making sure it's there just in time, how will the technology do that? And I think I bring up the technology supporting the process as the last item because I think oftentimes we take a technology and we make our process or design fit the technology. And I think it's important to, in some ways, design the system independent of the technology. Though there are limits to what the technology can do, it's not uncommon for there to be some level of configurability of the system. So do your best to design your perfect world, involve the right people to understand how it's going to happen, and then come back to the technology and say, this is what we want it to do. How can you support it? And I think I've seen that prove true in different projects. And I'll talk more specifically about one project here in a few slides, but it's important that the technology support that process. I can't stress that enough based on my experience. One of the questions that we often get through the earlier in the process is, well, how do you know which assets to track or locate? And like I said, this comes back a little bit to the location versus management. Some items may only be necessary to know where it is. You may only need to know where a wheelchair is. You may not need to know that there are always going to be 8 at a specific location. Perhaps the opposite is true. One of the things to think about is the size of the deployment. There are 2 different kinds of size. One is literally we're buying 1,000 IV pumps. That's a lot of equipment. That equipment will go throughout the facility or multiple buildings. One is that size of the facility. We have 4 hospital buildings attached across the street via sky bridges, and equipment's going to go through all of those different facilities. So what equipment is going to be traveling throughout? What equipment may actually be local? Oh, this bladder scanner never leaves labor and delivery. Or this piece of equipment is specific to cardiovascular care in the ICU. And understanding too, then, where it's utilized. If it is more of a regional or even unit specific piece of equipment, then the management or PAR leveling may not actually be necessary. However, as part of the system, you may just do location on that piece of equipment for that unit. Or maybe the PAR level is the whole unit and 1 or 2 items. So if they leave the unit, you can find it and bring it back to ensure that you have what you need. Whereas IV pumps, as I showed in that earlier PAR level view, if you have 1,000 channels and they're going throughout a building, large building, multiple buildings, even a smaller multi-specialty clinic, How do you ensure that you have those when you need them? So where is it utilized? Also the value of the asset. An IV pump, I'm going to throw out a number here. Last time I was involved, $1,800 to $3,000 a piece. You know, adding a locating tag to that and knowing where it is can be important, especially if it's a rental or lease equipment and you need to return it. It can be very important. It might have a temporary tag of some kind, but also then being able to inventory and understanding where those more expensive pieces of equipment are. However, I have an example where I worked with an interpretive services department. They had these lovely little hearing assistive devices, had a little headset, a little device that magnified the sound. They came to me one day, they said, these are walking out with our patients. They're taking them home. We'd like to know when they leave and we could track them down. I said, great. How much do they cost? And they said, oh, about $12.50. $12.50. And I said, perhaps that's not the best use of adding a locator tag, because if it's small enough and it can go in a bag, it might still end up walking out the building, and now you're out both the tag and the equipment. So sometimes it doesn't always make sense based on the value of the equipment. And another thing to think about as well is if you do have 1,000 IV pumps and you're starting to add them to a system, a technology, and you want to differentiate between them, well, is this IV pump 1? Is this IV pump with equipment number 1, 2, 3, 4, 5 that we've taken from another equipment management system? How do we differentiate between equipment? What's your approach going to be? And oftentimes the solution vendor can make some recommendations, but something to think about as you're deciding which assets to locate. And then again, you're hearing this again, this is like the third time, that understanding what type of accuracy and granularity of location that equipment needs. Is it just, it's in the lobby of the hospital, or this item is in room 104? Another piece that I think is important when it comes to making decisions about purchasing, understanding that utilization, some of those questions I brought up earlier on, is that most RTLS systems provide you with a lot of data. Oftentimes it's data in the forms of a SQL table that you can query yourself as an organization. Sometimes they have their own reporting suite that can provide some data. I think in this case, there are I'm going to talk about 3 different types of data. And in RTLS, of course, there's a real-time piece. You can see in this image here, this is an example of a dashboard. This dashboard is giving you real-time information about different storage areas and how much equipment is available. You can get real-time location information. We already touched on that. Par leveling, it's real-time data at your fingertips. This area is in critical need of some more IV pumps. And depending on an integration, you may actually be able to see whether a piece of equipment is in use with a patient. Valuable information in real time. There's also historical data. Now, there are a variety of ways to mine this data. I think a couple of common pieces are inventory, be able to run a report and understand your true inventory for a specific piece of equipment. And then also a utilization report. Maybe it's utilization by location, maybe it's a different kind of utilization, but trying to understand how your equipment has been utilized in the past, the historical view. And then sometimes there's proactive data. Depending on an integration or how you're managing the information of equipment, you may have preventative maintenance data in the system where you can pull a report and see that in the future, some things will need to be maintained and we'll need to locate them and start to think through that. I'm not to say that's a replacement for an equipment management system, or perhaps that information is coming from an integration with an equipment management system. But understanding too and asking the right questions around what data is captured. Is it location data only? Are there intervals, milestones? How can we access the data? Where is it located? All those kinds of questions to leverage the data from the system. The real-time pieces are invaluable, provide operational insight, but some of this historical and even proactive reporting or data can be very helpful, and it's something to think about as you plan and implement your system. And I've touched on this just briefly, and this is what I call my value add section here. And it's such that integrating with other systems can provide a lot of value. Specifically, I touched on that device status, knowing if something's in use. Maybe you have an integration with B-Braun or Alaris with IV pumps, where their system can actually send information on if it's dispensing medication or connected to the patient, or whatever information they can send to the Rtls system, such that you get that real-time data, you get that real-time information. You can see, hey, I need to find an IV pump. This one's in a room, and not only is it in a room, but it's actually dispensing medication. Or perhaps this one is in a room with a patient, but it's not dispensing. We really need some pumps. Maybe the nurse or the nursing assistant can clean that pump and get it out to me so I can move it around the facility. So the value there is pretty obvious when it comes to understanding if something's in use. And then we have the equipment management systems. IBM Maximo, Accruent. Can we integrate Rtls with those systems, either from Rtls with locations to the EMS, or back basic information about the equipment into the Rtls for tag assignment, or two ways? But the idea being that we're not in two systems, that we integrate in such a way that either the EMS or the Rtls can have the core important information, and biomed and clinical engineering and others can see the important information about equipment management and location right at one-stop shop. So those are two things to think about as you're working with a vendor. What types of integrations can actually provide real tangible value to the project? I want to talk to you about those tangible results. My ROI slide at the beginning, I talked about it being tangible. And I worked on a, excuse me, IV pump project. And I've referred to it a couple of times already. But the hospital I worked for, this health system, excuse me, was in the process of determining whether they would continue to lease and rent pumps and maintain their aging IV pump allotment, or purchase brand new equipment. And as they were performing their due diligence, they started working with, guess who, a process improvement engineer to look at how they distribute the pumps between 3 local hospitals. A 500-bed, million and a half square foot hospital, regional medical center, a local hospital that has ED and behavioral health services primarily, and then a critical access hospital 25 miles south. And they started to wonder if we could use technology to help us manage this distribution, this par leveling of equipment, such that they could purchase fewer items up front. So that project manager slash process improvement engineer brought the right people to the table. It was incredible. I was honestly surprised by the amount of people and the amount of departments represented during this project. We had those biomed clinical engineering folks up front, responsible for getting this new equipment in, checked in, and ready for use. We had supply chain folks involved in the planning of determining how pumps were going to be distributed, how the technology was going to work. We had caregivers telling us specifically, this is where we want that equipment to be ready for us at all times. And we had IT folks asking the vendor, asking questions of the stakeholders. How do we want to deploy this? What types of servers are required? What kind of infrastructure do we need to add to the facility? So they brought in the right stakeholders. And we came up with a great design, and that process improvement professional really did a lot of that. As an engineer, was able to pull in all these ideas, figure out tables. You should have seen this spreadsheet. It was impressive. Talking about the different equipment, where it was going to be located, notes from these different stakeholders, but came up with a great design that made sense to the stakeholders and then went to the vendor and said, this is what we want it to do. And excuse me. And I think that's where I come back to wanting the technology to support the design, and why I think that's so important, because I've seen that work out in the real world. This is an example of a view, not the one that we had at that facility. It's the same as before. We had these locations. You see down the left-hand side, different units. We established those levels. We had no notifications, even little pop-ups on the screen when something needed attention to alert the supply chain folks. It even sent out an email and a text message to important parties. The text often being to the person with the cart and the IV pumps already walking through the facility and leveling the amount of equipment in each area, who can in real time get that message and respond to it. And what was interesting is, through that design and desire and decision to move forward with Rtls solution, they'd reduced the initial purchase of IV pumps by 26%. They stopped leasing and renting of equipment, specifically IV pumps. And from day one, based on that reduction of purchased amount and the leasing and renting, saved $600,000. I had to honestly get some explanation on that. How did you come up with that number? And it was pretty impressive. So it more than paid for the technology. The other questions we asked at the front was, can we improve our ability to find equipment when it's needed? And you'll see on that fourth bullet point, if you have the equipment you need when you need it, you're better able to provide the best care for your patients. And instead of, like this example gives, 6 calls a day down to supply chain to bring them equipment, we actually started and did change the culture and move from that hoarding, that little location where only the people in that unit know our equipment is, to trusting that IV pump would be ready for them. After initial implementation of 700 new IV pumps, which was a reduction from 1,000 approximately, they started to look at other equipment. Some of it was purely about location, knowing that we had feeding pumps. Some of it was about par leveling. We need to know that these few items are where they need to be when the caregiver needs them. And they were able to reduce and, again, make good decisions during purchase or renting of equipment based on the real-time data, some of the historical data, and just the operational insights that Rtls was able to provide for them. And they continue to save money based on that. So this is a high-level, review. There is a tangible return on investment. There is an initial potential and initial savings that can more than pay for the technology. Those are the things that those C-suite folks want to hear, right? And it's different. If you're not buying 1,000 IV pumps, you're just looking to add to the allotment you already have, it may just be that you are better able to make that decision and such, save some money when instead of purchasing 50 or renting 50, you rent 25. So just what's the return? There are a variety of returns. Some of those are more about finding equipment and having happier caregivers and spending less than an hour a day looking for equipment. The systems do also provide data, real time and reporting, historical and proactive. What are those pieces that you're getting? How are you going to use them? How will they help you make better decisions? How will they better help you manage the equipment you're using? Truly understand your inventory and reduce the amount of time you spend doing inventory. Cultural transformation. I've hammered on that one quite a bit. I want to share a story. I meant to share it earlier. As an anesthesia technician, my responsibility in the operating room was to set up all the anesthesia equipment for each case. And there was a team of us, so it's not like when we have 24 operating rooms, I was the only one. But I often set up the open heart procedure rooms. And open heart procedures are a pretty big deal, and they require a lot of extra equipment. A TEE, a scope for monitoring the heart during the procedure, a variety of pressure lines, extra medication. Those pressure lines and any sort of intravenous fluids require an IV pump. And in those rooms, often 4 to 6 to start out. Some that they know they'll use and others in case they need to give blood or platelets or epinephrine or something else during the procedure. So my job often was to find those pumps. And the challenge was that before RTLS, you had to do that walk around the unit 3 times, look in all the secret alcoves. And I used to walk over to the ICU where the patient was going to go post-operatively. And I would walk up to the desk and, hey, do you all have any extra IV pumps we can use for this open heart procedure? And the answer was, oh, we don't have enough, and when we're out. And I would sometimes point to the room where I knew the patient was going because their name was on the door already. Say, well, they're coming to this room. Could I have that pump? And, well, we might need that in a pinch. And invariably, it would be this back and forth where I would then start walking around their unit, trying to find their secret cubbies, and sometimes even just say, hey, could you call the anesthesiologist in the operating room and let them know you don't have one? Which of course then often triggered that, well, you can take this one. But it was this kind of battle. This is, of this is ours and we're not going to give it up, or we've tucked things away. But with that project that I referenced, we were able to change that culture, and it built that level of trust, not just between the equipment and supply folks, providing that it's there when they need it, but even between units. There wasn't this battle for equipment, this wondering if they're going to have what they need, especially in those critical care environments like the emergency department or ICU or the operating room, surgical services. And instead, they could trust that they're going to have the equipment they need when they need it. And that sort of cultural transformation is hard to put dollars on, but is a true benefit of a RTLS solution like this. And of course, we've said it multiple times, reducing the amount of time people spend looking for things. Yes, if we can get that reduced at all, there are lots of studies that talk about the value, both in a subjective way as well as a dollars and cents way, about how we can calculate that. But it ties into the cultural piece as well. If caregivers are not spending as much time looking for equipment and at the bedside more, which RNs will tell you emphatically is their desire, then we build a happier workplace as well. And all this that I've talked about, questions to ask or you have asked, approaches to how we do things, involving the right people, ROIs, all that comes back to the patient. A system like this has lots of benefits for employees and for the budget, but truly, if we have a system that can support our caregivers, build that trust that that equipment will always be ready when it's needed for the patient, in the end, what we're doing is we're providing better patient care. And that is at the crux of everything we do in healthcare. Can technology improve the experience for the patient? And I think in this case, with asset management, it's clear to see how that's true. So at this point, I want to hand it over to my teammate, one of our marketing folks, Katie, and let her tell you a little bit about our organization.
Thanks, Doug. Appreciate it. So first of all, thank you to everyone who joined us today. You might be coming to this with some familiarity about RTLS, or you might be learning about it for the first time. So either way, we're really happy that you're here with us. Doug touched on lots of great points. There are so many factors that go into the purchase and implementation of an RTLS system. And as you can see, there's a lot of different vendors out there for you to consider. So I'm going to take a brief couple minutes to tell you a little bit about Versus. Versus has been the leading provider in the real-time locating space for over 25 years. We work with a variety of clients, from small rural clinics to multi-site IDNs. And as a subsidiary of Midmark Corporation, Versus contributes to a unique offering of clinical workflow solutions that include consulting services, RTLS, medical equipment, diagnostic devices, and design assistance. And all these things really help health systems rethink the delivery of care. So there are really 3 things that make us different as an RTLS vendor. First of all, Versus brings scalable RTLS use cases, which are deployed across your enterprise where the greatest benefits can be gained. So these modules not only deliver visibility to people and assets, but they also enhance patient throughput, and they ensure that resources are effectively managed. Second, Versus offers the highest rated RTLS location accuracy on the market. Doug talked a little bit about the technology and what makes us unique. Versus offers wired, wireless, and Wi-Fi locating platforms to create seamless interoperability. And then lastly, our team is with you each step of the way. We bring over 25 years of experience in solution design and clinical process management, and we utilize best practice methods gained from health systems around the nation. So Versus offers hardware, software, and services, and all under one umbrella, an ecosystem of solutions that offers seamless growth across the enterprise and consistent, reliable performance. So I want to bring it back to managing assets, and as you heard from Doug, RTLS is a very financially prudent investment, and so I'm going to tell you a real quick story about one of our clients. You see here on this slide, this past year, McLaren Healthcare, which is based in Flint, Michigan, they implemented Versus RTLS for asset management at their hospital, and they saved $1 million in capital expenditures. So even more than that, they increased their IV pump utilization by 133% by using par-level asset management. A smart investment for sure. You can download the McLaren case study at versustech.com/assets to read the whole story. And another thing too, if you're attending the HIMSS conference in Las Vegas in March, you can hear the story in person. So Dave Dickey, who is the Corporate Director of Clinical Engineering for McLaren Healthcare, will be giving a session all about using RTLS for asset management. So again, thank you so much for joining us today, and I think I'm going to hand it back to Lori now for questions.
Thanks, Katie. Now we'd like to open it up to the audience for questions, as Katie mentioned. As a reminder, please use the questions section on the GoToWebinar panel to submit your questions to Doug. Doug, the first question is from Scott. He would like to know how the RTLS software links to the preventative maintenance software.
Yeah, I think that's a great question. So I'm going to be really honest up front and say that this is not my area of expertise, but we have a team of software engineers and folks who have built bridges or integrations through it via interface between systems like Maximo or Accruent that allows that information to transmit between the systems. So I think I talked about a couple different ways we could do that, where the RTLS system is sharing information with the management system. So when you're in there, you can not only see that something needs to be given a PM, but where it is, or the other way, where some of that, when you're assigning that little locator tag per se, that equipment information can be sent over and integrated into the RTLS at assignment, so that the equipment number, the description, some of those things are consistent and then flows right into the RTLS system. But the interface there, that gets a little more in the weeds of the technology, and I'd be happy to follow up on that and get you connected to the right people that could speak more specifically to the interface itself and how it's structured.
David would like to know if you've experienced any cultural challenges when the RTLS is used for monitoring people, like their location, where and how they're spending their time and such.
Yes, I think that specifically around location of people, both caregivers, staff, and patients, is always a challenge. If I said no, I've never experienced a barrier, you would know I was not being honest and forthright. When I supported the system, that was always one of the challenges. What I think really helps as a former customer in a hospital setting was tying anything we did around locating people directly to patient care. So oftentimes RTLS is a value add to a nurse call system, and that integration allows some passive functionality. Say there's a call from a patient, the nurse is wearing some sort of locator, walks into the room, and by just being present, cancels the call. So there's a positive ROI specific to that caregiver at the bedside just by wearing the locator. The other thing I used to often tell folks on unit when I would go up there and they're like, oh, big brother, is that one, nobody in your organization, myself as an IT person, people looking at the data, no one has the time or is all that concerned about the individual movement. And really it's about this operational insight that the system can provide, the aggregate of the data. So I think it's important that they understand what the ROI is for them. Sometimes there's even an ability to do some sort of staff emergency or staff assist, whether a button on the badge or some other way to trigger it that provides them immediate assistance when needed, that passive functionality of presence, turning off a dome light or canceling a call. So trying to tie everything again back to patient care and what a system can do for nurses or doctors who are even more of a challenge. What's that ROI for them? We had that OB situation I talked about, an L&D project, labor and delivery. The buy-in from our OB providers was great. If they were their locator and they went in for the initial consult with the patient who's there, antepartum, not yet delivered, and they're in there for 2 minutes, I think was the rule that we created, and they leave, it triggered a change on the view, and all the nurses could see that the doctor had been in there. Well, guess what? OB doctors stopped getting calls. Not altogether, but it reduced greatly because they weren't getting that, hey, have you seen this patient in 1201? Nope, they can just look in real time just by their presence and being in a room with a patient that consult has happened. So how do you find those ROIs for the individual caregivers such that they get the buy-in and they understand how it's going to improve patient care? I think that's the biggest way to kind of sell it and overcome some of those cultural challenges.
The next question is, what are your recommendations for success with ongoing support? What types of teams like biomed, IT, integration, or a combination of those are best suited to support an RTLS system?
I think that's a great question because I stressed the importance of the stakeholders during planning. It's also important for those folks to be included in the ongoing maintenance and support of the system. I will say every organization has a subtly different way of supporting it. We have, I've seen some customers where they don't have like an IT systems analyst that supports it, and biomed is responsible for the system. I've seen in my previous role as a systems analyst, we had RTLS in multiple facilities, and we were responsible for the ongoing maintenance and support, the interaction with the vendor. So at the same time, I think, so I don't miss the purpose of the question, in the IV pumps scenario I talked about, the project, we kept in touch with the supply chain folks, IT, and biomed, because they each had a small part to play. When new equipment was brought in, the biomed folks would actually affix the locator tag to it. They would enter it into the system. So making sure that they continued to have what they needed to perform those tasks. Supply chain was those folks that we depended on to make sure that equipment was moved around by using that technology. So we continued to engage. Sometimes we had regular calls. Sometimes it was an actual visit to the department, which wasn't always easy when I was located in Oregon and some of our facilities were in Washington. But how do you continue to engage those folks and make them part of the system? The one thing I want to stress that I didn't talk about, because it was more about planning and prep and a little bit of implementation, is that the ongoing support really takes effort. And once you use a system, an RTLS system like this, you're going to learn how you want it to work better. So not only continuing to engage with those stakeholders, but including them in the process of how can we make this system better? We did these notifications and they work like this, but it would be really great if it did this. Or we had an ED situation for patient throughput, and the ED nurse said, hey, we always have these phone lists for our staff. So folks from radiology and lab can call us if needed, or even the providers can contact us, but we have to print it out like every couple hours because we have so many shifts. So we created a view with a real-time phone list, and they could put their name in their phone, and as it came throughout the day, these other departments could just look and see who was assigned to what room and where, what their phone number was. So it's those kinds of continued optimization, I think, that are also important, and those stakeholders that were helpful in the project will have some of the best feedback for you.
Thank you. It looks like we're out of time, and so we have a couple more questions that have not been answered, and to those of you who posed them, someone from Versus will get in touch with you and respond to you directly. I want to thank everyone for joining us today, and thank you, Doug, for the great presentation. As a reminder to attendees, watch your email for links to the recording of today's webinar, as well as the PDF version of the PowerPoint presentation. We look forward to seeing you at our next HIS Talk webinar, and I hope that you enjoy the rest of your day.